Before we begin, here's how to earn continuing professional education credit for attending this session. Gain valuable insights by attending the podcast, then complete the assessment test to download your certificate. To do this, follow these simple steps. Click on the link in your description to access the session. Create a free account and attend the podcast. After the podcast, take the assessment test and download your certificate. It's easy, and it's free. We highly recommend checking out our subscription.
Yeah, and one interesting thing I want to share is every person I interviewed and talked with, they all have a vision. They all know where they're going, a career goal. And I always go back and ask, it's because just from my personal interest, like where do you learn those from? Who you're really following, your role model? Because being in the initial ages of your career, it's really hard to see what I'm going to do down the road in 10 years. But they all have some kind of vision in their mind that where they're going. Maybe it's administrative, maybe the specialized nursing. So what do you think those plannings and those visions are coming from in those early years of their career?
I think maybe I think like they are very oriented right now, the social media, and they are more oriented about the technology, what the technology brings. So and like the other people, for example, it was very hard to teach someone on using technology, for example. But the
Mhm.
new generation, they are ready. You just tell them this is the link, and we have something online, for example, a virtual class or virtual training. They will be engaged. So this is good, I think. So I think like either like I mean they use the technology a lot, or maybe like their mindset right now is more focused about technology and about thinking about their future. I totally agree with you. If you just ask me before 15, 18 years, if I ask one of the employee, where do you see yourself in 5, 10 years? They wouldn't know. But today, for example, when I interview someone, I ask about where do you see yourself in 5, 7 years? And she told me, she said, I want to be honest with you, I'm not sure, but I think I'm approaching that way. I'm heading toward that direction, and maybe something else will happen. But yeah, this is my plan, this is my vision. So that was really something new to me.
Hello, everyone. Welcome to HR Next, Unpacking Trends and Talent Innovation podcast. Today's episode number 16. I'm Farhan Sadique, and we have with us Dr. Issa Balushi. Today, we're going to talk about fostering growth in the healthcare in Oman workforce. We'll talk about the international perspective, healthcare training in Oman. In this episode, we'll be exploring the intersection of healthcare and human resource from a global perspective, discussing strategies used to build critical skill in Oman healthcare sector. First of all, I'd like to invite Dr. Issa Baloshi with us. Dr. Issa Baloshi, can you share with everyone about your background in HR and training?
Hello, everyone. Thank you so much, Farhan, for inviting me to be part of this interesting podcast. And this is so glad. I mean, like, I'm so glad to start talking about my background. For the last couple of years, when I was in the PhD program at Penn State, we did not talk a lot about the program. We were more focused about our research and those things. But after coming back and finishing the PhD and getting back to the job, we are different positions and different things that going on around here, the country. It's worthwhile, I mean, to just talk about it and express some of, like, let's say, highlight some of the pain points and things that we are going through here in Oman. So yeah, I started my profession in nursing, where I graduated with bachelor degree in nursing science from Villanova University, United States. And I did not practice nursing a lot, to be honest with you. Once I finished my bachelor degree, I came back and I worked for 1 year and a half, 18 months. And then I started working in the training staff development for, let's say, 4 or 5 years. And then some kind of changes has occurred in the Ministry of Health, where the small units of training department, we're just dealing with the nurses, by the way, that time. And then the program, the department has emerged and we were just taking care of the whole, all healthcare professional at the hospital level. So at that time, I started working as head of training and staff development. And then the department has also evolved more, where we're having a lot of trainee. The hospital was expanding. We had a lot of new specialties just emerge and join and came to the practice. At that time, the title was changed to professional development and career guidance. So this time they introduced the career guidance, as you know, the importance of career guidance in the profession and how important it's to prepare the practitioners for their future and keep them like on track of their career development ladders. So yeah, until 2009, and then I had my master degree in medical education. This time I tried to make it very focused toward medical education. But the good thing about it, I complete my degree at Cardiff University, United Kingdom. And at that time, I tried to incorporate a lot of training and simulations into my master degree. My thesis was about a clinical practice or clinical placement, where I tried to focus to make how we can make an atmosphere that is, inductive, conductive, for training for trainees inside the hospital and also for the healthcare workers. In 2019, as you know, I started my PhD in workforce education at Penn State. At that time, I was kind of, let's say, very busy working as a graduate assistant with a lot of teaching, a lot of research, a lot of, like, let's say, very interesting things in HRD, career development and organization development. So now I'm back. I'm back to the Ministry of Health. I'm back to the work. There are several positions. Looking or waiting for me. So I'm right now in the time where I'm just trying to pick whatever suits for me. I know, like, in Oman, we have a vision called 2030 vision, which is, like they meant to just upgrade the whole system, let's say from now until 2030. And before 2030, we need to just project another vision, maybe 2050, something like that. So now there are big responsibilities, managerial level, leadership level. But at the same time, my main focus is about still keeping and practicing research, although like I'll be very busy with my lot of managerial job, managerial work. But my focus is about to keep research and teaching one of the principles that I need to just work and involve.
Very interesting. You bring in a lot of global experience, global education, and also practicing in Oman. Um, for those who are unfamiliar with the Oman, can you provide some context about the healthcare system of a professional development specialist or approach of training and development?
Yeah, I think this is very great question, and I was expecting that I'm gonna have it because Oman healthcare system, like it's like the other five GCC countries here. I'm talking about United Emirates, Saudi Arabia, Kuwait, Qatar, and Bahrain. Our healthcare system is funded by the government. So
Mhm.
mainly, like, there's a Ministry of Health taking care of let's say around maybe 11 regional big hospitals. There are some specialized hospital always. And there is also another second level of healthcare, which is called primary healthcare. But I'm working at tertiary level. Tertiary level, like, it take care of the all specialties, all patients, all categories. The region that I'm working with maybe could be the second largest region in Oman after the Muscat capital. We have only one hospital. For example, like, we are serving more than 2,500 employees who work in that hospital. So this is great job. As you know, the healthcare in Oman is free. Like, the government pays everything, including the primary and tertiary level care. Uh, Training and staff development that I work with is part of the department that take care of everyone, all healthcare professionals in the hospital. At the same time, we work a lot for the ministry as well in developing guidelines, protocols, and a lot of things related to to the healthcare training and professional development.
Do you want to earn CPE credit? Take this course of MyCPE 1 to earn free credit. Click the link in the description to get started.
Oh, that's awesome. So, how does your role as a professional development specialist fit into that sector?
Exactly. This is also another important question. I believe the focus is about trying to bridge the gap. As we say, the Ministry of Health governs all the healthcare in Oman. So it means it produces some policies, some guidelines, some protocols some, let's say, roadmaps that we have to follow. So I think our role at the training and staff development at those big regional hospitals was about trying to bring the gap in incorporating and applying those policies by designing, implementing, evaluating our own training program at the hospital. Most importantly, I think one of my roles, being qualified in developing need assessment, was about how we can develop and specify needs of the healthcare professionals and try to direct those needs in order to make good training plans, evaluate the training plan, and maybe go more advanced to just develop something more higher or more advanced. And sometimes we have to be alerted about any changes in the healthcare around Oman, for example, around the globe, for example, during COVID-19. So many things happen. So we have to be alerted to see what kind of training needs are there. So just we have to signify it, we have to put a plan, and we have to put it in action.
Interesting. And what does the Oman culture influence, how it influences the design and delivery of the training programs that you're creating for healthcare professionals?
Exactly. As I said, it's like free charge. Like that healthcare service in Oman, it's free. So it serves everyone in the community. Even like we have a lot of non-Omanis, the internationals who just are dealt with at the hospital level. So maybe if we talk about the culture of Oman, like as you know, Oman is one of those Arabic Islamist country that we have big communities liaison between the culture level. So just we have to make sure that we are respecting the community people, the members, the families, also the religion, the Islam, as you know. Also taking care of like the thing that Muslims need actually while being admitted in the hospital, how we can deal with males separating than female, for example. We have, for example, a lot of women who are just admitted in the hospital. At the same time, we have to make sure that they have their own privacy, their own cultural norms, and whatever they believe on. At the same time, we have some traditional things that happen in the community level. Also, we have to make sure that those things are not brought to the hospital setting. We don't want to mix anything coming from the tradition from homes to be applied at the hospital, because otherwise it contradict with the surgeries and other medical thing intervention that people provide. So yeah, it's very challenging, by the way, working with that community who's very connected, who's working on together. They are like, listen, for example, visiting time. I never seen, like, let's say in the Western countries, so many visitors come the evening time. I did not see that thing. But when you come, for example, in Oman and like those similar countries, you will see hundreds of people are coming from 4 to 6 p.m. every day to visit their family members. And that's something we have to respect. We have to be there for them. We have to just try to provide whatever they need in order to provide a very good environment that they can come and visit and make sure. And as per the studies, per research, they found that, bringing family members to the hospital is it's good relationship, like with the cure, with the treatment level, because they feel very happy. They can see their family members, especially with those people who are just stay for a long time.
Hmm. Very interesting. That's differently that definitely a different challenges. Thinking about the families and visitors in the office time or visiting time. Um, if considering the training programs or developing those training programs for the nurses, what unique challenges or opportunities do you see compared to the global standard? As you talked about the cultural differences for the patients, what do you see as a challenge or opportunity for the nurses or the training programs that you're providing for them?
Exactly. Like, not only nurses, as I said, we took care of the all healthcare providers. I'm talking about the doctors, the practitioners,
Okay.
the nurses, the allied healthcare professionals, also even the administrative. We have quite good number, maybe around 180 admin who work in the hospital. So just they were part of our training plan. I think one of the challenges that we have been having, first of all, maybe I would say less qualified people who could work with me and with the team. This is, very common in different places. But like, at that time, I tried to just solve that issue by making a lot of training of trainers, preparing those people to just be like helpers who just can work and can intervene. Another point is about resources also, as you know. Sometimes, like, I mean, everything is connected or linked to the budget, specific budget, specific financial support that they provide to us. So if you want to plan to do something else, they would say you have to wait next year. That was another limit. And also another important issue, like dealing, for example, with the let's say very senior doctors here.
Mhm.
Um, some of them, they were reluctant to change. They were reluctant to get trained, to just be involved in any kind of training, because they think that, I mean, they reach a higher level of education and qualifications, which is enough, which is wrong actually. This is very wrong assumption, because especially in medical field, training and updates comes every minute and every hour, so just they have to be updated. So these could be some of the main the challenges here. One of the challenges before, I remember before 10, 15 years about, I mean, the system in Oman was not up to date with the global updates and orientation and things. But I think this is over. This is no more valid point here, because everything works with aligned with what's going on around the globe. And that was very obvious during COVID-19. Oman has been one of the strongest system and providing healthcare and following up what the WHA and the evidence-based practices did around the world. So that wasn't an issue. If you talk about the opportunities, I think right now we have a lot of Omani highly qualified. Let's say if before 15, 16 years, it's very hard. It was very hard to see a consultant in very, let's say, unique specialties. But nowadays, most of them are Omanis. Maybe there are more than 90, 95%. Some specialty, like, I mean, they're 100%. In nursing, before COVID-19, we were around 90 something percentage of having Omani nurses in every specialty. But COVID-19, the expansion of the department, expansion of specialties brought that number down. But Oman is number one in terms of number of local nurses in our comparing to GCC country, which is very promising, by the way. And another opportunity, which I think which is very good, is about people nowadays. Like, I mean, they want to link their practice to evidence-based practice, to simulation, to research, instead of relying on traditional or whatever they think this is right or wrong. But now they're more, let's say, very oriented about what's going on in the research, what's going on in simulation, what the evidence says they have to need to go and apply it. So this is very good. Since I came back, I was really impressed about huge number of conferences and workshops and education events that they do right nowadays in the country, not in our hospital, like in the whole country, where everyone can go and can join and can attend those conferences, which is very promising, by the way. And this is very good for people to get trained and get updated with the recent changes.
Very interesting. I see your program and the hospital and the training programs are growing constantly. Let's think about a global perspective. And as you said, you have been to UK and then you studied at Penn State University. How do you think your international educational experience has shaped your approach of training in Oman?
Exactly. That was something in my mind. I thought, like, I mean, if it, for example, before going to my PhD, I thought maybe like I reach a highest level of expertise and being, I mean, let's say, updated and everything. But when I went there, I thought, no, although like I have a lot of experience in terms of more than 15, 16, 17 years, but I mean, being involved in actual research and actual teaching and knowing some approaches, some methodology that, I mean, people apply in training and human resource development and other approaches. This one was the additional thing here, getting oriented, getting to know to exactly what's going on in terms of the human resource development, training methodologies, approaches, what people have been using. And as you said, when you said, what did the global change? I mean, made or like I mean, it added to you. This is another point. For example, working with you, Dr. Farhan, working with the team who came from diverse, let's say, contexts, backgrounds, from different countries. That was very, very rich, like, I mean, learning and talking about them. Maybe like things that I did based on my context was totally different. But when you talk with the people and they know exactly how they dealt with it and with I mean, what kind of thing that they went through, that was very great. We learned a lot of things, how they did it and how they dealt with it. Sometimes people think that, I mean, it's about financial resources. I don't think it's about only financial resources. It's about sometimes approaches and intervention that someone would provide or would think about in order to do something. So that was a great point. And for example, in the UK, like, I mean, my training was based in the hospital. So we were trying to get involved with the new update, research update, how they were dealing with some specific issue, specific problem, or specific challenge. So that was great. But at Penn State, for example, which is focused toward research mainly, so that was the beauty of everything, getting involved in research. So, for example, right now, when I come and like I talk about an issue, for example, at the hospital level here, I wouldn't approach it on traditional way. I would think about what's going on regarding that issue based on the research findings, what people found about it. So, for example, right now I'm preparing something about the use of AI in the healthcare, for example. I thought the first thing that I need to start with to go back where the people finished. It's about the finding of the researchers, bringing those findings and what they found and how we can apply them. So this is something that I mean I did not have before. I mean having my master's and the PhD, but now right now I think like I mean I'm working that direction more, focus about evidence-based research, bringing a holistic approach instead of focusing about it from a narrow point of view.
Access latest and trending CPE courses with my CPE One Unlimited Access subscription. Subscribe now.
Very interesting. So you're talking about what you have learned and also using those analyzing tools and need assessment to understand what you really need to apply. And I can also feel like you're talking about a bottom-up approach. You talk about research and you go back to the people and ask them what kind of changes that you want to see. Probably that might be another practice you do. So what global trends? So these are kind of like the global practices that we do learn about. What do you see in the healthcare training and HR strategies that you have found most applicable to Oman healthcare workforce, or maybe some practices that you have seen or theories that you have learned but you customized for your need?
Exactly. Um, I would say that there have been a lot of things being done here, a lot of efforts, a lot of interventions, but maybe focusing about, for example, in the healthcare is very complex environment. It's not like a straightforward. It's very hard to understand what's going on in a specific context in medical, for example, or let's say nursing or allied healthcare. So I think the approach right now, I worked actually when I came, I was attached in the Ministry of Health. So like, I mean, I went through different departments, directorates at the ministry level. One of the interesting things that I mean they wrote from the global let's say updates and orientation about competency-based education. So now the focus is about what competencies are needed in every specialty, for example. So based on those competencies, they would go and align everything based on that competency. So for example, what competencies are needed by a doctor who's assessing a patient at the ER, in the ER room. So based on that specific competencies, you can go and define what kind of training, what kind of interventions needed to that specific doctor or nurse, for example, which I like more. And I heard a lot about it from the literature, competency-based education or training or learning. But actually, when you apply it, it's very complex point. But I think this is very promising. Also, e-learning, like, I mean, we used some sort of e-learning before, but I think thinking about bringing e-learning, let's say, something even like let's say e-learning in terms of the practice, how you can apply e-learning, for example, telemedicine, how we can teach people to just they can see a patient, they can assess a patient, they can take a history of patient while having it online. They did not have it before, like the approach was not that much. Also, this point is very, very connected to what you talked about earlier about the Omani specific culture, people
Mhm.
are not very well oriented about being called by a doctor who just talk about their case, introduce some intervention, and then he writes some prescription to them. So this is very interesting how we can bring e-learning and e-medicine and telemedicine to the system. One of the things that I have been working before was about instead of having, let's say, scattered training platforms, why we don't have simulation-based training? I know this is very required a lot of budget, financial support and other things, but this is something that we need to bring. We don't have very big institution of simulation, but I think, like, I mean, people are very aware right now about it. So this is very promising. I think in 5, 10 years, maybe less than that, um, each institution, each organization will be having their own simulation training center where they will be equipped with everything so people can get trained and they can use it as a lab before going and applying on patient. So this is something very important. And as you know, and you're fully aware, AI, what
Yeah.
AI has made, and like those new changes. So I think bringing AI to the healthcare in Oman, they started working. They started bringing big systems from outside Oman, from like around the countries, let's say here and there, how they can use AI in medicine. This is very promising. So instead of a patient being, let's say, assessed by a doctor and what he thinks or what the other consultant thinks, those things should be getting from the AI. So, for example, whatever they just bring that. So, for example, the sign symptom of the patient. So, the AI platforms, AI system, for example, should tell the doctor and the nurses what's going on with this patient based on the information that you put, based on the data that the platform that you use. So this is, I think, very promising. This is something they are thinking about, and like they're trying to bring it. This is very important. I think it will save a lot of time, a lot of efforts as well.
Interesting. You're using all those updated modern technologies and trying to utilize those in your training and development program. Um, but if we talk about the theories and practices that we see in the career development, or the theories and practices we see in the HR development, do you use any of those tools or instrument in your practices to help the nurse, doctors, or healthcare professionals?
Yeah, we have like I say, I wouldn't say that advanced system of simulation, but yeah, there are some kind of training used, like use simulation. So, for
Hmm.
example, let's say a very basic technique, which is about putting a IV cannula into a patient hand.
Yeah.
The traditional ways, I mean, like we had to use it in different pipes and artificial hands. Now there is like specific system where when you put the cannula, for example, it tells you exactly, it will tell the nurse if she's in the correct vein or no, or like she had to put it, or what the angle, for example, while putting it in the hand of the patient, it will show on the screen, on the monitor, the angle, the direction, and everything. So she knows exactly she's in the right track or no. Also, we have very advanced system of advanced cardiac life support, for example. So now by pushing hard, the system will tell you how depth you are going, how fast you are doing, how effective is your compression, for example, and it would tell you what are the next step, which is about, for example, giving ventilations or giving to breath, and maybe putting or giving some medicine. So this is very good, The old system wouldn't do that way. I mean, like you have to do it just blindly and apply what you learn from the theory. But I think those new systems are very good. They started using them, and we have them here in the hospital as well.
Wow, very interesting. And if we talk about the general HR practices, what your insights about the role of HR in fostering culture of continuous professional development in the home and healthcare sector?
Yeah, exactly. I would say, like, I mean, the HR was kind of separated before from
Okay.
training and everything. The focus was about training, like they thought about training was the only HR intervention. But I think this is correct right now. And now, like, they're trying to make it a holistic approach where training is part of the HR. So HR intervention start from the time where the new employee come to the hospital, for example, the onboarding process, and like I'm going through the required training and like other mandatory trainings and the other specialized training that they have to go through. Also, for example, introducing the culture of lifelong learning. This is very important in the hospital scene, where every healthcare professional should know that. I mean, once he joined the healthcare field, for example, lifelong long learning is part of his, let's say,
Mhm.
lifelong learning process. It does not stop at all. It grows up as far as like in he moves. One of the new thing that I mean, Farhan, Dr. Farhan, I saw here is about we have a new system of evaluating the efficiency, the effectiveness of every worker. So, for example, there's a new system called IJADA. IJADA is about link. Every employee has to put personal goals based on organizational goals. So they have to do it every 6 months. So, for example, right now we are about to finish the second half of 2024 goals. So every worker had to put the goals in July, let's say, or June, and then approved by his head of department, where those goals should be linked to his performance. So by December, he would go and just put the findings and the final outcomes of the goals, and then he will be evaluated again by the head of department or director, for example. So this one ensures that every employee should put specific goals, and he had to make sure that he achieved them in 6 months, and then he is ready to move on to put new goals. They did not have it before, but this is the new system. It started maybe 2, 3 years back when I was there. When I came in June, I did not put my earlier goals, so like I had to go and put my second half of it. To be honest with you, that was kind of just trying to keep me on track, that I put some goals and I need to achieve them. And
Mm-hmm.
there are different levels. And for example, you have to indicate what percentage you achieved of this goal and what
Mm-hmm.
percentage is left. So you can take the same goal, for example, for the next half, for the second year, where you can just advance it more. So this is very nice system. So many people are still, let's say, unhappy about it, but I would say this is very good. At least every employee now has goals. He knows exactly what to do. But maybe from my point of view, from HR perspective and an organizational perspective, these goals should be linked to the organization. For example, there should be like a vision and mission of organization every 6 months. And then every department has to link those goals with the main organization goals. And then each employee has to work under that umbrella. By that, we are achieving, let's say, individual, department, director, and then the whole organization in a state of having scattered goals. But never mind. I think as far as they started with it this way, this is good. It will be like developed day by day. I think year by year. So in the future, 5, 6 years, I think every organization will have very strong related goals, which are linked to the whole country vision. When we talk about 2030 or 2050, something like that. So this is very good.
Yeah, understandable. With any changes, there's some sort of resistance, and as you start those new practices, as you see the benefits, but I think it will take some time to kind of settle down. But I can really speak for the practice that you started, having a goal for every 6 months and following up with supervisors. It's a very impactful practice, and I think there will be a lot of benefit in the long run.
Sure.
Um, and another issue let's talk about is the engagement issue. When we do training and development consultancy, there is always a piece of engagement, and day by day, it's getting lower percentage of attention span time. So, how do you feel about engaging healthcare staff in the training programs that you initiate, or the intervention you particularly in the high stress environment like the nursing profession or doctor profession? They go through a lot. We also talked with the nurses who went through the initial training programs or for a year. We asked, tried to understand what their experience is. So, can you talk a little bit about that and how you deal with those situations?
You're absolutely right. And I think, yes, you know exactly what's going on. Maybe this could be like you had at least three projects with me. So like, like the healthcare context, the healthcare background is very complex. It's something like, like for example, it's very hard to expect how the work is gone in one day. It's very hard. It's very challenging. You don't expect what would happen in 1 hour. You don't expect what happened in 1 week or one day, for example. That's why one of the challenges that we have been having in training is about um, having non-compliance. A lot of people who miss the training because of they were busy, they are doing something else, they're in charges or supervisor did not release them. So that has been one of the issues here. But what I would say, like, for example, the approach that have been using is about try to involve those people to be part of every training. So every training should be based on needs, on needs assessment. So those people should be part of the needs that they identify and involve them, involve supervisors, involve leaders to be part of that training. And then this was very good. Second thing, also sometimes, let's say use the power of the management as well. Something like, I mean, those things when it comes from the management, it makes some power, and it makes like, I mean, yeah, this is something valuable. So just we need to come and interest. And also like we were having good database. So every worker knew exactly how many hours he attended, how many hours he required to do, what kind of training he went through. So these were very good. Um, to be honest with you, like I mean, finishing my PhD and like I mean, being working with the pioneers like Dr. Rathwell and the team, and you are one of them, learning a lot about appreciative inquiry. It's a very excellent approach. We can use it that way instead of relying only on mistakes and highlighting the negative things. We can focus on appreciative inquiry to highlight the strength and try to just focus about the positive learning environment. So this is very great approach. And you are teaching now, so you know exactly what happens in the mind of those new young generation, how we can bring them. If you make the stick and try to just hold them and bring them to a training, they don't care.
Right.
But if you involve them, okay,
Mhm.
try to make them part of it, they are highly interested. They will be highly interested. They will be engaged. So these are one of the approaches that I have been trying to enforce here, to make people aware about it and use it while dealing with the new generation. So when I came, for example, I would say more than 75% of the old workers who are working with me, they are no more in the hospital. So we have new people, new faces, new doctors, new nurses. So now the challenge is about how we can work with those people. During our current study that we both are working on it, I'm really impressed about the mentality and the thoughts and the thing that they shared with us. So,
Mhm.
so this is very promising to me, to be honest with you. This could be the first project that when I came and I dealt with it. So this is very promising. It does not give that this generation is very hard to deal with, but I think the approach that we need to adopt, we need to use should be different than what we used to do with our old people and our old colleagues previously 15, 20 years back.
Yeah, yeah, and one interesting thing I want to share is every person I interviewed and talked with, they all have a vision. They all know where they're going, a career goal. And I always go back and ask, it's because just from my personal interest, like where do you learn those from? Who you're really following, your role model? Because being in the initial ages of your career, it's really hard to see what I'm going to do down the road in 10 years. But they all have some kind of vision in their mind that where they're going. Maybe it's administrative, maybe in a specialized nursing. So what do you think those plannings and those visions are coming from in those early years of their career?
I think maybe I think like they are very oriented right now, the social media, and they are more oriented about the technology, what the technology brings. So and like the other people, for example, it was very hard to teach someone on using technology, for example. But the
Mhm.
new generation, they are ready. You just tell them this is the link, and we have something online, for example, a virtual class or virtual training. They will be engaged. So this is good, I think.
Yeah.
So I think like either like I mean they use the technology a lot, or maybe like their mindset right now is more focused about technology and about thinking about their future. I totally agree with you. If you just ask me before 15, 18 years, if I ask one of the employee, where do you see yourself in 5, 10 years? They wouldn't know. But today, for example, when I interview someone, I ask about where do you see yourself in 5, 7 years? And she told me, she said, I want to be honest with you, I'm not sure, but I think I'm approaching that way. I'm heading to what that direction, and maybe something else will happen. But yeah, this is my plan, this is my vision. So that was really something new to me.
Mhm.
The new generation will bring like new things. So this is very good for us for us managerial or leadership positions, how we can take all of these let's say interest and think that they are working on it and incorporate it, make it in one direction, help them as well.
Yeah, I found it interesting too. It was really surprising just to see those people having the clear vision. It was like, I wish I had at that age of or time of fear. It changed. It might change in the future, but eventually it will help them to grow. And another thing, as you just mentioned about the technology, they always Googling and they're always looking for these terms, learning more. Whereas I can think of like 10 years ago, they were not allowed to use cell phone in the hospital. They're not allowed to use cell phone in the OT, but now they have cell phone and they have the capacity to look for terms, because as a nurse or doctor, you don't expect everyone to know everything, or rather
You're right.
use those technology to kind of support
You're
yourself.
right. Absolutely right. I mean, I remember when we like, for example, when we had a difficulty knowing a medication, for example, its
Mhm.
classification, its action, indication, and those things, we had to go to the main office to look for a drug book, and then try to find the drug name and the indication, all information related. But now, within a click, you just will be able to know exactly what's going on, everything about this medication, and indicate it to the patient. So this is great right now. And like as you said, they have Wi-Fi even like in with the patients, so that they can use it very easily. So this is
Mhm.
very promising. This is very great, I think.
Yeah, very interesting. Talking about the trends and the future and using technology, how do you see the role of technology? I know you talked about simulation and we just talked about different uses of technology, but e-learning platforms or simulation-based training, we just discussed a lot. Evolving in the professional development of the future workforce, how do you see that?
I think it's evolving. Also, like for example, let's say work at the public healthcare field, for example, where they have a lot of new machines, and those machines are based on AI systems, you know. So, in order to use them, they have to train people how they can use them and how they compare them. Otherwise, it's waste of money, you know. Like I mean, buying all of these very expensive machines, and no one can take care of them. So this is like linked right now with the training. So we have to train those people how they use them and how they can use like get advantage of those machines. So this has been new trend here, trying to train those people, bringing the companies who are serving, who are delivering those equipments, and train them. And also, like I mean, take advantage of the global advancement and development around the globe. You know what's going on terms, for example, how you can diagnose an X-ray. For example, previously, for example, diagnosing a case using an X-ray, for example, you have to go and ask the consultant, or you have to report it and someone has to write it back. Nowadays, it's about putting that X-ray, for example, digitally in the computer. You just scan it and put it there, where a consultant are sitting 24/7 at the ministry level to report it back to you and give you feedback, and you can chat with them. You can get all information. So just you can provide the care in 5 minutes, in 10 minutes, in 1 hour, while you are just sitting with the patient. Patient is still in the X-ray department, the ER department. You are getting the responses and feedback from the consultant who are taking care of that X-ray. So this is something, I mean, very great. Like I mean, it's like it just indicate highlights the use of the e-learning, for example, the AI, for example, using technology at the same time. We have a lot of, let's say, phones, and people, like for example, they used to fax reports. Nowadays, there's no faxing. You have every system, and like everything in one system. All X-rays, laboratory, diagnosis, medical diagnosis, and the system right now also linked with the primary health care. So you'll be able to know exactly when he was seen in his small health center, for example, and why he was seen, what they advised to him, for example. You can both base every intervention based on the history of the patient. Unlike before, the patient had to come bringing his labs results, bringing his X-rays, bringing his reports and everything, and you have to go through everything in detail. So that was time consuming. Is like I mean, to take a lot of time and efforts as well. But right now, e-learning as well. I talked also earlier with you regarding the telemedicine right now. So instead of bringing patient all the way 50, 100 kilometers to the hospital only to just prescribe the monthly medication, you can just talk to him over the phone in a call or phone call or whatever, and then advise and prescribe the medicine where he can take it from the nearest local health center instead of coming to the main hospital. And imagine how many patients we are saving, like how many patients we are removing from our list daily doing that thing. So yeah, technology has playing a lot. The role of the training and role of HR becoming bigger and bigger. They have to be aware about it, and they have to get trained. The good thing about it, when I came, my colleagues who work in training department, they got new friends as well, new colleagues who joined them. everyone is like, I mean, striving to update himself, to keep himself up to level, you know. This is something like unlike before, where you can stay in the same job for 10, 15 years with your same qualification. But right now, no. I think they have to just be very fast. Otherwise, everyone will just cross them, will take their positions as well. So that's what they are pretty aware about it.
Interesting. One interesting fact that I came to learn about Oman healthcare system is just you are striving to kind of really competing with the modern facilities, and you have all the almost you mentioned all the modern facilities that we see here. Particularly the nerve detecting system was one of the recent thing here as well that you can see the nerve and instead of looking in your eyes, you can scan the hand and find because I see those challenges everywhere. It's like sometimes they poke us 3 or 4 times to find the nerve and put a medicine. So it's kind of very interesting that you do have those technology already. And also you're utilizing modern simulation-based training and technologies in the practices and training and development. Is there any training or micro learning tools that you used or you see that's benefiting the nurses or doctors to learn more that you're providing, or is all their self motivation that they are trying to learn in their workplaces?
I feel like I'd say like the change in the generation and how they think
Mhm.
about it, the technology, the advancement, also the guides, the guidelines, the map, the roadmap that I mean the ministry sometimes impose on them. Those are very helpful because they have to start with it. But maybe the role of the training here, for example, before it was about how we can coordinate those training, how we can plan those things for them, also how we can provide the resources in terms of the computers, in terms of the infrastructure, in terms of the facility that they need to just develop those training. And sometimes it's more of coordination more than of doing things to them. So just you coordinate things to them and they can just do it themselves. We One of the principle that I mean I was working in even before was about trying to make specific plan for every department. So just make them responsible about their training needs, training plans where we as general department that we coordinate everything to them, we help them. For example, if they lack anything, for example, we can help them, but make the training specific to their needs, make them part of their training plan. That was very important. Also, as I said, I used to perform a lot of training of trainers. So I prepared many trainers at their levels. So they are ready right now. They have the knowledge, but they were not able how to know how to they can teach, how to develop a workshop, how they can coordinate a conference, for example. But when we taught them, for example, we scaffolded their training learning process, they were able to do it themselves, where we asked like coordinating and standing away from them, trying to see what they need and what we can help with.
Interesting. And one interesting question that I have is as that we interviewed a lot of the nurses mentioned that they use technologies, Google. I know patient use that too. So do you see any challenges or any benefits out of it? Because that way you don't have any limit, like this is not we do or this is what is done worldwide, and all the information is right on the palm. So how do you face those challenges or opportunities to grow? Because nobody's going to say, okay, we don't do that. You have to provide all those services, and there is no boundary on it.
Exactly. This is one of the new trends that we try to introduce. When I came back, I tried to just give it to my friends here, my colleagues who work in the training right now. Is about preparing the new generation, those new workers who join the hospital setting or the healthcare setting. Is about the importance of keep themselves updated and highly developed, because even the patient, when we talk about the employees, even the patients right now, most of them are from the new generation, so they are fully aware. They know maybe more than what we know about their case, for example. So they will argue, they will ask a lot of
Mhm.
questions. So if we are not up to level to answer their questions, maybe like we shouldn't be expert at everything, but at least we know what they are talking about, or we can take it from there and just bring the knowledge they're lacking, and then we can just offer it to them in a better way, maybe. So yeah,
Mhm.
those are one of the principles that I mean also we try to influence here. We have to try to bring, while preparing those, for example, the 1 year enhancement training nurses who we have more than 100 right now. And we used to have, let's say, also, let's say, had maybe 20 doctors every 4 months coming to the hospital. So again, how we can prepare them. and how can they be updated, and looking forward to just keep themselves up to level, because the patient right now are let's say ask a lot of questions.
Mm-hmm.
They have open queries. If not, it's mean that the patient will not trust them, will not have confidence on them. But
Yes.
yeah, as I said, this is very promising. The new generation is working very hard. Um, our role right now is more advanced. I think it's more advanced than before, the traditional way of teaching and trying to just give them ideas and information. That's it, and little bit of skills. I think right now it's about scaffolding their learning process and see how what they need exactly.
Yeah, scaffolding of learning process. That's a very important term, I think. And also, you mentioned about confidence and trust. I heard that a lot as we interview a lot of nurses and trainees. That's interesting. Is that something that you built from the core, like building trust and confidence, and something else maybe out there? Or that's kind of like what is very common practices in nursing, that you have to earn trust and confidence from the patient?
Yeah, exactly. Trust and confidence. And one of the principles that I have been trying to bring to the healthcare culture here is about teamwork. One of the
Hmm.
deficiency that we have been having, like everyone work alone, so that there is no teamwork. So like one of the thing I was in, teaching a lesson here in the leadership course is about the teamwork. It's not about doctors who just they work collaboratively. No, it's about every specialty has to work for the sake of the patient. If they don't collaborate, it's mean there's a gap between them. So, for example, if I do 100% good job, but the other department would do 70 or 60%, the other department would do 80. So it's mean there is a gap. But imagine, like, once the patient arrives to the ER till the time he was discharged from the hospital, it's kind of continuity. How many practitioners he faced, he encountered so many, not only doctors, not only nurses, admin, cleaners, the the ambulance driver, the medical orderly at the ER, the pharmacist who prescribed the medicine, the lab technician who was taking care of the laboratory things and those things. So it's let's say a multidisciplinary action. You have to work with the whole team in order to produce a very holistic, very comprehensive care plan. Otherwise, there will be like gaps in the care plan. So this is something that I have been trying to bring to the system here.
Interesting. Yes. Well, we had an opportunity to learn a lot about home healthcare system and practices. I'll just take a few more minutes to learn about more about you. What really inspired you to dedicate 20 years to train and development healthcare field?
Well, this is very good, great question. As I said, I started nursing profession, but once after I finished my bachelor degree, and I think that was good start when I had my bachelor degree from Villanova University at United States. I learned a lot. I practiced in the hospital setting. So when I came back, I like teaching, to be honest with you, but I did not like teaching at the college level. They offered me a job at that time to go to be a faculty of nursing at the college level, but I said no. I love teaching, but at the hospital level, where I can teach my nurses, for example, at the hospital, in the hospital, at the bedside. So this is for me, it's more of kind of interaction, more of um, ability to teach because you're working with the environment. It's not about the students where you can simulate everything, but it's about the patient and everything. So that was an inspiring thing for me. It's like, my passion has emerged from there, coming from the United States and having a lot of ideas, but still we don't have a lot of this and like about how we can involve training and make it better and better. Also, maybe I was inspired by the impact of well-trained professionals on patient care. So many people who were acting as a role model for me as well at the hospital level, at the ministry level, and those people inspired me. And you just talked about something very excellent, Dr. Farhan, about the trust, the confidence, and when those people, let's say, seed something on you, like a trust on you, oh my goodness, that grow up with you. When I finished my PhD dissertation, there was one guy who retired. I went back to him. I texted him. I said, I just finished my dissertation defense, but I think all credits goes to you because you are the one who inspired me. You are the one who put the professional development seed into me. At that time, I was, let's say, 5, 6 years experience only, just able to teach small lesson. But you inspired me. You took care. You took me to that second level. So sometimes there should be some people like those people, they can just make some trust, build some trust on you, make some confidence on you, and delegate a lot of work on you. Even if you were not thinking that you are capable of doing those things, but delegating and giving responsibility, that was very efficient. So I was so lucky to have some people in my professional life like those, and help a lot. And also, like sometimes, let's say it's come like kinds of internal things. For example, like I live, let's say, 35 minutes away from the hospital. So my work starts at 7.
Mhm.
Since I started the work, I would be there by 6:30, let's say half an hour, more than half an hour sometimes, before the actual working time, and not leaving until like half an hour after the work. So it's mean that passion was with me, even like when I was very, very young. Right now, I'm becoming older and older, but yeah, that passion was with me since that time. It did not go. I came back with my PhD. I have the same habit, maybe, which is very promising. Finishing the prayer, finishing everything, going to your job, to your duty. I mean, earlier, where you can stay there, plan the whole day, plan whatever you want to do, and also see what you achieved yesterday. And based on that one, you evaluate and put your plan of action. So these are the principle, the individual professional principle that I put. And I used to teach my students as well how they can develop themselves and how they can keep it up to date. And like, because working in the healthcare is very complex, very demanding environment. If you don't have those internal passion and those internal interests and motivators, you will be like having burnout within 1 year or 5 years. You'll feel that, I mean, this is not a good place for me. And sometimes we don't wait for the ministry and for the other people to come and just take us from a level to another level. Sometimes we have to work hard. We have to show our efforts and ourselves in order to reach a different specific space.
Very interesting. Any last piece of advice for the aspiring training and development specialist in healthcare, paying it forward? We talked about some people who supported you through your journey. What do you have? What do you want to offer to the next generation?
I would say maybe like, I mean, the current generations, let's say level is very promising. They are like really smart. They knew a lot about technology, but maybe the trick is about using technology sometimes is about scaffolding your knowledge and skills to use it to advanced level. Don't depend totally on the AI only. Just try use the AI in a way that, I mean, you are building and you're developing and you're progressing. This is very important. Also using like building a good teamwork among the teams in any organization is very important. Connect with the people, learn from everything, learn from the problems, learn from the successes. Use appreciative inquiry more better than the other, let's say, punishing approaches. Also, most importantly, as we are using AI and technology, stay up to date with the global trends. And right now, we talked about you have to know exactly what's your passion, what's your career passion, what you are aiming to. So build everything, put your plans, put your goals from here, and try every time in between, evaluate them. And there are so many mentors around you. So look for a mentor where you can work, you can get attached with them and see how we can evaluate and guide you, for example. It's very important as well. And also, don't make scattered goals. You have to link your goals with the department, with organizations, with the country level, with the ministry level goals. This is will be aligned. This will show some good effects and impact at the end. But if you just work individually, let's say just put a goals. And I talked about the IJADA system, that system that we have here for putting professional goals. If you put goals for the sake of just filling up the goals, this is not effective at all. Put actual goals. Maybe I would say put some challenging goals as well. This is very good
Mm.
also to just keep you up to date.
Very interesting. All the information you shared. We do have a great learning moments. I really appreciate you joining us, Dr. Issa Balushi, in our Building Skills in Healthcare episode 16 on HR strategies for training in Oman. I hope the audience had a wonderful time as much as I did. I appreciate you for coming us and giving us some time, giving us taking us to the whole journey of yours. Very interesting learning opportunity. Thank you for joining us.
Thank you so much, Farhan. That was a great opportunity to be part of this interview today, and I hope I was able to just reflect a little bit about the wonderful healthcare system here in Oman. The current minister, for example, he started the way that he did it based on what the great achievements. And right now, the new technology, the new system that he and his team is building up is very promising. By the way, it's aligned with the country vision, with the global healthcare visions. We can see a lot of recent updates, development, changes every day. So this is very promising. Like previously, we would think about being in a very developing healthcare system. But right now, I think we reach some level of already developed systems where we have the locals, Omanis, leading everything in healthcare. So this is a very great opportunity. I think this is the correct time for me coming back with my PhD and being part of the whole team here.
Thank you. Thank you. Hopefully we'll have you back again in some other time in another capacity. Always great to learn from you. I was fortunate enough to be with you for 4 years, and it was great learning opportunity for me as well. I really appreciate what you're doing and continuously doing research to support your team and your profession. Appreciate that. Thank you.
Access latest and trending CPE courses with my CPE One Unlimited Access subscription. Subscribe now.